All right, let's talk about something that's super common, but also surrounded by a ton of confusion. Ovarian cysts. You've probably heard the term thrown around, maybe a friend had one, or maybe you've even been told you have one. But what does that actually mean? Is it always a big deal? Well, we're about to clear all of that up.
So here's our game plan for this little tour. First, we'll nail down what an ovarian cyst even is. Then, we're going to look at a map of all the different types, and trust me, there are a few. After that, we'll get into what they feel like and the problems they can cause. And finally, we'll walk through how doctors figure out what's going on. Let's do it.
Okay, first things first. Before we can get into all the nitty-gritty details, we have to start with a solid foundation. So let's answer that big question. What is ovarian cyst, really?
At its heart, the definition is actually really simple. It's just a sac filled with fluid that happens to be on or inside an ovary. Think of it like a tiny self-contained water balloon. That's the basic idea. But, and this is a big but, that's where the simplicity ends.
Right. And this is probably the most important question of all. The answer? A huge, definite no. Not all cysts are created equal. In fact, ovarian cyst is more of a catch-all term for a bunch of different things. Understanding which type you're dealing with is what really counts. So how do we start telling them apart? Well, we can split them into two major families. You've got functional cysts, which are totally normal and tied to your menstrual cycle, and then you've got pathological cysts, which are caused by some kind of abnormal cell growth.
And here's how that family tree breaks down. On one branch, you have the functional cysts. Think of these as the totally normal, expected kind. Then, on the other pathological branch, it splits again. You have benign cysts, which means they're not cancerous, and you have malignant cysts, which means they are.
Let's start with the functional ones, because honestly, these are the superstars of the cyst world. They are by far the most common. They're just a normal little hiccup in the ovary's monthly routine. Most of the time, they show up and then disappear on their own without anyone ever knowing they were there.
So for example, take a follicular cyst. Every month, your ovary grows a little sac called a follicle, which is supposed to release an egg. But sometimes it's like the follicle just doesn't get the memo. It doesn't pop open to release the egg, and instead it just keeps on growing and filling with fluid. And voila, you've got yourself a follicular cyst.
And besides that follicular one we just talked about, there are a couple of other common functional types. A corpus luteum cyst happens after the egg is released, if the little sac seals itself back up and fills with fluid. Then there's the hemorrhagic cyst, which sounds dramatic, but it just means one of the other functional cysts had a little bit of bleeding inside of it.
Okay, so we're leaving the normal, everyday functional cysts behind. Now we're moving over to that pathological branch. But before you get worried by the word pathological, remember, we're starting with the benign kind. And benign is the key word here. It means not cancerous.
And this is where things get weird in a fascinating way. Look at this chart. You have dermoid cysts, which can literally have hair, skin, or even teeth inside them. It's wild. Then there are endometriomas, which have this nickname chocolate cysts because they're filled with old, dark, thick blood. And finally, you have cystadenomas, which are just filled with a watery or mucousy fluid.
Now we do have to talk about the third and most serious category, the malignant or cancerous cysts. It is really important to know that these are the least common type by a long shot, but they are a possibility we need to be aware of.
The names of these often sound a lot like their benign cousins. You can see serous and mucinous on the list again. And there's also this really interesting gray area called borderline tumors. These are cysts where the cells look a little abnormal, but they aren't fully cancerous yet. They're kind of stuck in limbo, somewhere between benign and malignant.
Okay, so we've got our map of all the different cyst types, but what does any of this actually feel like? I mean, how would you even know if you had one of these things? Let's talk symptoms.
And here it is, the single biggest takeaway about symptoms. Most of the time, there are none. Zip, zilch, nada. The vast majority of cysts are asymptomatic. They live their little lives and disappear without ever causing a problem, and are often found completely by accident.
Now, when they do cause symptoms, it's usually pretty vague stuff. You might feel a dull ache in your lower belly, maybe some bloating or a feeling of fullness. Sometimes people experience pain during intercourse. It's not always super obvious what's causing it.
But sometimes a cyst decides to stop being quiet and starts causing a major scene. This can lead to sudden, really severe problems. It's what doctors sometimes call an ovarian cyst accident, and it's a sign that you need to get help right away.
These accidents usually come in three forms. First, the cyst can rupture or burst, which causes a sudden, sharp pain. Second, it can bleed a lot, which is a hemorrhage. Or third, and this is the most serious one, it can cause the ovary itself to twist.
And that twisting, called ovarian torsion, is a really big deal. The weight of the cyst can literally make the entire ovary flip and twist on its own stalk, which cuts off its blood supply. This is a true, time-sensitive medical emergency. Getting treatment fast is everything when it comes to saving the ovary.
So you've got this huge range of possibilities, from feeling nothing at all to a full-blown emergency. How on earth do doctors sort through all that and figure out what's going on? Well, let's walk through the diagnostic process.
The approach is actually pretty straightforward. It all starts with a physical exam, but the real star of the show is the next step, an ultrasound scan. This lets the doctor literally see the cyst, check its size, and see what it looks like inside. Is it just a simple bubble of fluid, or is it more complex? After that, some blood tests can offer even more clues to help solve the puzzle.
And that brings our little tour to a close. We've figured out what a cyst is, we've mapped out all the different kinds, and we know how doctors find them. But discovering the cyst is really just the beginning of the story. The next question, the one that really matters, is, what do you do about it? And that, well, that's a whole different conversation.